All right, y'all, before we dive in, let's set the tone. This is The Broken Shift. We speak up for the ones who were silenced. This week, we're zooming out because abuse in healthcare isn't just happening in your unit or your state, or even just in the US.
From Florida to France, from Tokyo to Toronto, nurses are being threatened, disrespected, and attacked while doing the work of saving lives.
Today, we're taking you inside stories of global workplace violence, the headlines, the silences, the cultural excuses, and what happens when the people trained to help are the ones needing protection.
And it's not just strangers. It's prominent figures. It's administrators, it's patients, it's families. Sometimes it's the very people who demand our compassion, weaponizing it against us.
We'll talk about what happens in Japan, where nurses are routinely beaten and kicked and told it's part of the job. And we'll connect the dots to your facility, your contract, your mandatory smile policy.
Because abuse might look different around the world, but the damage feels the same.
This is The Broken Shift, and today we're calling it out everywhere it shows up. Let's start in Japan, where a recent incident has brought the issue of patient harassment into sharp focus.
In April 2025, a 44-year-old woman named Hirosui was arrested on suspicion of assault after she allegedly kicked and scratched the arms of a 37-year-old nurse at a hospital in Shimada, Shizuoka Prefecture. The attack occurred around 12:20 a.m. on April 8th, leaving the nurse with minor injuries. Shizuoka Prefectural Police have not confirmed whether Hirosu has admitted to the allegations. And while this incident made headlines, the truth is, for many nurses in Japan, this kind of abuse isn't rare. It's routine.
That's right. A 2019 survey from the Japan Nursing Association found that 1 in 6 nurses quits their job within the first year, citing overwhelming workloads, poor pay, and repeated incidents of verbal and physical harassment.
The silence around these issues is not because the violence is invisible. It's because it's institutionalized. Nurses are told it's part of the job, that speaking out is unprofessional, that the patient's intent matters more than the harm.
And it's not just anecdotal. A nationwide study in 2018 showed that more than 10% of pediatric healthcare workers in Japan reported verbal or physical abuse from patients or their families, and that's just those who reported.
When violence is normalized, nurses internalize it. They start questioning whether what they experienced even counts. That's the damage culture can do.
This is not just Japan's issue. This is a global warning. Abuse doesn't always start with a slap. Sometimes it starts with silence.
Japan's not alone. Let's talk about what this looks like globally.
In the UK, the National Health Service (NHS) reported over 56,000 cases of abuse and violence towards staff in a single year. That's more than 150 incidents per day, and those are just the ones logged.
In India, hospitals have seen doctors and nurses mobbed and attacked by angry relatives after bad outcomes. So many that some emergency departments now keep security on every shift as a standard.
In the United States, more than 40% of nurses say they've been physically assaulted on the job, most often by patients or their family members. And that's not counting the verbal abuse or racial slurs that many deal with daily.
From France to South Korea, Brazil to Canada, we're hearing the same things. Short staffing, high stress, and a system that doesn't back its workers when violence shows up in a scrub top or behind a visitor badge.
And let's be honest, the cultural excuses vary, but the impact is almost always the same: fear, burnout, trauma, and silence.
Coming up in part 3, what leadership and legislation are doing or not doing to stop this.
Let's talk about leadership, because when violence happens, who steps up? Who shields the nurse? Who changes the policy?
In far too many cases, the answer is no one. Or worse, leadership gaslights it. That's just part of the job. You must have said something. Let's move forward.
But we do have examples of leaders doing it right. In some U.S. hospitals, nurse-driven safety committees have real power. They push back, they escalate incidents, and more importantly, they get follow-through.
In Canada, several provinces now mandate reporting and investigation of all violent incidents, even verbal ones. It's not perfect, but it's something.
In Japan, after high-profile incidents, unions are calling for legal reform demanding clearer protections, better documentation, and crisis training for all staff.
but without consistent follow-up, even the best policy is just a PDF collecting dust on a SharePoint folder.
In part 4, we talk about what this does to the hearts and minds of healthcare workers. When you're told to smile through violence, something inside you cracks. You want to know what all this abuse does to the inside of a nurse? It fractures you bit by bit.
First comes the adrenaline, then the questions. Did I provoke them? Should I have handled it differently? And that's the trap. That's what silence does. It rewrites the story so you're the problem.
A nurse on Reddit said it like this: "I've been bitten, hit, and spit on. HR told me to de-escalate better next time. I started wondering if I'd done something wrong until I realized no one should be okay with getting assaulted at work."
That kind of moral injury adds up, and we see it in the data. Studies show that nurses who experience workplace violence are twice as likely to report symptoms of depression, anxiety, and PTSD.
And yet most of them keep showing up because the patient still needs meds, the monitor still beeps, and nobody's giving them time to process what just happened.
In part 5, we're going to look at what some facilities are doing to finally acknowledge that trauma and how it changes the game when healing is part of the shift.
So what happens when a facility does acknowledge trauma? What does it look like when healing is built into the workday?
Some hospitals are doing it right. We're talking debrief protocols after codes, peer support teams that check in after violent incidents, and recharge rooms where staff can reset. No questions asked.
In places like Henry Ford Health, their Caring for the Caregiver program created 24/7 emotional support and saw stress-related absences drop by 45%.
Other systems like the Cleveland Clinic offer code lavender teams for crisis support. It's not perfect, but it's proactive, and that changes everything.
Because when trauma is acknowledged, nurses start to feel like humans again, not just bodies on a shift.
Coming up in part 6, what real global advocacy looks like. Because from Japan to Jersey, healthcare workers are demanding more.
When systems fail us, we speak louder, and right now, healthcare workers around the world are demanding more.
In Japan, nurses are organizing through unions and advocacy groups, calling for clear legal protections and tougher penalties for patient violence. They're done with silence.
In the U.S., the Workplace Violence Prevention for Healthcare and Social Service Workers Act continues to gain bipartisan support, aiming to require facilities to implement violence prevention plans.
In the UK, frontline staff are getting vocal about banning known repeat offenders from hospital premises, with support from police liaisons built into the NHS system.
These movements aren't just policies, they're people. People saying, you can't heal a system with duct tape and apologies.
So whether it's unionizing, writing op-eds, joining walkouts, or speaking anonymously, advocacy is rising, and it's global.
And if you're listening to this thinking, what can I do? Just know you already did something.
You listened, you got informed, and maybe next time, you speak up for the nurse beside you.
Coming up next week, a shift in tone, a shift in rhythm, and a shift in voice.
Episode 11, Letters from the Break Room. You won't want to miss it.
Next week, something different.
We're turning the mic over to you.
We'll be sharing anonymous stories, confessions, and truths from nurses, aides, and techs around the world. From the break room, from the bedside, from the heart.
It's raw, it's real, it's exactly what you've been needing.
This is Letters from the Break Room, and you won't want to miss it. We'll see you next week right here on The Broken Shift, because nursing shouldn't break you.